Hey, everybody, welcome back to the Prime Pediatric Podcast. Y'all, I have an amazing, wonderful guest for you. I have known this woman for over half a decade, and she is an absolute amazing doctor. Her name is Dr. Nikki Cottis from Gulf Shores, Alabama. She's been in practice for over 10 years. She's been on her own for over 6. She's an absolute delight. She's one of my very, very close friends. I absolutely love talking to this woman and getting a chance to just talk about her life and what it's been like to be a women chiropractor, a female in practice, and just what it's like to have actually a very, very successful practice and how that all works. Dr. Nikki, how are you doing? It's so good to have you on.
Yeah, I'm great. Thank you so much for having me. Give me all the warm fuzzies.
Yeah, well, you're amazing. So I ain't kidding about any of
Well,
that.
thank
I've known you for years, and I always am excited to talk to you, and I'm always excited to see you. I absolutely adore you. So why don't you go ahead and introduce yourself just a touch to our audience here at the at Prime Pediatric Podcast, and let them know just a little bit about you, because they might be surprised at how similar our backgrounds kind of are and how we know each other.
Yes. So my name is Nikki Cottis, and I do have a practice in St. Gulf Shores, Alabama. So it's a small coastal town right on the Gulf of Mexico. I've been in my own practice for about 6 years now. I've gone through all kinds of different trials, tribulations, figuring it out by myself as a solo practitioner over that time, but really feel like we've found our ideal client and our niche, and just kind of expanding with that over the past few years.
So now with you being in practice for over 6 years, and your practice is amazing. You have the most wonderful, warm practice down there at Gulf Shores. And just, can you walk us through what it's been like for the last 6 years? Now that you've been on your own, what are some of the steps you did early on in practice to give you a really strong foundation in chiropractic? What has kind of set the groundwork for you to take off now in the last couple of years to just be the absolute amazing doctor that you are, Dr. Nikki?
So hands down, one of the best things I've ever done, which is how we met, was through a practice evolution program. And so that is where we met, and where I definitely built my foundation of growing a family wellness oriented and women and children focused pediatric practice. So that has been something awesome. Then I got really involved in the birth community. Before I even got pregnant, I started looking into the birth world and preparing myself personally for birth. So I did a lot with birth education. I did birth fit. I did childbirth education. I got certified in all of that. So I've done all of that. Now I'm currently a member of Black Diamond Club, how we still maintain contact, which has been the next best thing for my business to help get me to that next level.
Mm-hmm. Yeah, I think being in Black Diamond Club just kind of has been an amazing opportunity for myself. And then when I got a chance to absolutely fall in love with it, you were one of the first people that I turned to. Was like, oh my God, this woman needs to be in this program. And
Yes.
the business side of it, business side of being a service professional, chiropractic notwithstanding, it's important to understand business, important to understand how we make everything work from a service provider perspective, not just chiropractic, but how we take care of our patients. And then how do we take care of them after the adjustment and before the adjustment, right, Dr. Nikki?
Yes.
So let's just, what the hell with it? Let's just jump into that right away. So what have you done with the patient experience in your practice? The adjustment, I know you're an amazing adjuster. I know you're subluxation based. I know the training you had with Kairos and with all the other adjusting specialties you've done, and you've had training with me. What if we take the adjustment out of it? What have you done to set yourself apart and be just the awesome doctor that you are, and all your public just loves you? So what have you done?
We have, as far as patient wise goes, number one, the minute they walk in the door is making them feel not just welcome, but like we've done our research and we know all about them. So what are their likes? What are their dislikes?
Mm-hmm.
How can we best serve you specifically? Knowing their name, knowing their family, knowing why they're here, what they're here for, and that they're in the right place. So making the patient, number one, feel comfortable. Number two, we do lots of little different things. So every patient gets like a nice water bottle that has our logo and such on it, but it's like a nice glass one. Everybody loves that because they're like, oh, wow, a small gift just for stepping foot in the door. We have their patient name when they come sit down in the new patient room. So they're like, we were prepared for this visit. We show them where everything is. We get them coffee. We do all of the little things that make someone feel like they're walking into our home. Here's the bathroom. Here's where you would get coffee. Here's where we have creamer. If it's a mom, hey, we have everything you could possibly need for your kid. We have diapers, wipes, extra clothes, everything that may come up when you're seeing moms and kids.
It's that experience. And I know it because I do it. We do it too. And in chiropractic, and I'm going to get kind of, I hope this isn't an ass saying, but a lot of docs in our profession feel that initial tour, that initial getting to know your surroundings isn't that important. And what's your thought process on that? I think it's one of the most important things you can possibly do is show them everything that goes on in your office. So there's no hidden doors, right? What's your thought on that?
I couldn't agree more. And I always think of myself personally when I go somewhere new and the front desk is super standoffish. They don't know your name. They're just, hello, are you here? Why are you here? Go have a seat. And then you're like, well, is there a bathroom I can use? So now I have to go ask them, hey, where's your bathroom? Hey, do you guys have any water? I've been sitting here for like ever and I'm getting really thirsty. So just trying to be preeminent about what a new patient needs and how we can do that before they even have to ask, I really think is what sets you apart. Because I know personally, whenever I go somewhere, I feel so uncomfortable asking because no one likes to ask for directions, especially women.
I get it. And it's like, it's the truth. Men know, I mean, it's you.
Nobody does.
Nobody does. And if you don't feel welcome, if the front desk is stodgy and the person at the front desk, it's probably female. And if she's a type A personality, she works her tail off, which means she has a really good RBF going on, which means that she just, but that's because she's focused. Well, the issue with that is then what happens? We lose the focus on the patient, which is focus number one. The mom that's had the new baby, the mom that's either new to pregnancy, like they have every thought in their head as to what's going to go on, and our job is to blow them away. And I know that that's how me and you have both been trained and how we think all the time. So now you've went through that amazing new patient experience, which I know is top notch. And I think getting to know your patient, you hit on something, is getting to know your patient before they even get in there, understanding who they are, the age of their kids, who, if they're there for themselves, what makes them tick, do they like certain water, do they like certain coffee? It just adds to the experience. Because let's be honest, they'll say, like, I can go get chiropractic down the street. Well, you can't get Dr. Nikki chiropractic. I can guarantee you that. And you can't get the experience they have in your office. Now, let's go into something that's pretty amazing. You being a woman, and now you have your little daughter, Hazel, and she is a little bug, an absolute beautiful Southern princess. Walk us through what it's been like first starting out. Now Hazel's what? She's 3 now, correct?
Yeah, she's 3. Yes.
Yeah, she's 3. So 3 years ago you had Hazel, and you kind of went through being pregnant right in the middle of opening your practice. You were 3 years in. So you were right kind of in that 2 to 3 year mark, which is actually really difficult for young docs. That 2 to 3 year mark is either you make the step forward or you make the step back and you close up or you go work for somebody. What was that experience like for you? Can you walk us through what it was like starting off pregnant and then going through this whole experience now 3 years later with Hazel?
Yeah. So you're right. When you're in 2 to 3 years in, it's kind of like you're just finding your groove. So I feel like I was just getting settled in. Practice was great. And then I thought, let's just mess everything up and have a kid. So I also had presented that I wanted to have a baby to my husband, Jonathan, kind of like a business plan, which sounds insane. But I was like, hey, here's when I think the best time of year for us to have a baby would be, and here's why. And this is a downtime during the business. So I had planned to try to have a baby around Christmas.
So you sold your husband on getting pregnant.
Yeah, and I was like, hey, this is a 1 month try, and if not, we'll just put it off. Yeah, I know, it's crazy.
I love it. Hey, go on.
So,
I thought it was awesome.
Yeah, and then, but in my head too, I was like, it's acceptable, quote, to take some time off around Christmas, which is also your mindset before you have kids, right? Like just totally business driven. Just like factoring everything that you're doing around one specific thing, and that's your business. So I had tried to plan to have a baby around Christmas, and lo and behold, I did get pregnant, and Hazel was born December 19th. So it worked out pretty perfectly. But the whole time that I was working, it just, looking back, of course, you could be like, there's so much things I would do differently. One thing I would not do is work until I was 40 weeks pregnant, seeing 300 patients a week by myself. It was the physical and mental tax of that was incredible. And then just thinking, I'm going to work until my due date. I'm going to work until my due date. And then I also had planned to have a home birth. In 2018, home birth in Alabama was not legal. So we were having what's called a border baby, where we were driving back and forth to Mississippi to see a midwife there. So now you're running a practice, you're driving 2 hours each way to see a midwife. And yeah, so you're just also adding this extra stress of, I really want to have a home birth. And so I had mentioned before I even got pregnant, I did all of the work. So I did all of the things, and I didn't just take childbirth education classes. I became the childbirth educator. I, became certified in that. And I thought this will not only help me, but it will also help all of the moms that we always see and help prepare them for their birth. So yeah, just working by myself, overdoing it. So many regrets.
So many regrets. And that's, yeah. So then let's fast forward, because you had a quote unquote border baby, which to me sounds funny yet alarming, because they don't allow home birth yet, which is not okay in my book at all, which increases your stress level. I'm sure your stress level was freaking nuts. And then you were seeing 300 patients in your office, which is a massive pat on the back. That's amazing. You're seeing a volume more doctors wish they could get to 10 years into practice. And number two is the amount of stress and physical toll that puts on your body. Now, I know your birth story a little bit, but I think let's talk a little bit about it, because I think it's a humbling experience for a lot of moms to understand, especially in the chiropractic space, where things just don't quite go as planned. Can you talk about this? Because I think this is something really important for our moms and our female chiropractors and male chiropractors together to understand and really get what you went through. Can you talk a little bit about that, if it's okay with you?
Yeah, of course. I think you nailed it when you said humbling experience, because that is truly what it was, a humbling experience. So I remember my water broke on a Sunday, 3 days after I was done working. And again, I was like, wow, this plan is working so perfectly. My maternity leave starts Monday. Let's go have a baby Sunday. Awesome. So my water broke, and I was I was not in active labor. And so from everything that I knew, I already knew that I was setting the scene for, number one, being on a clock, number two, needing to get things moving. And so I did everything I could to encourage labor to start, and it just really wasn't happening. So I actually called Dr. Christina Stitcher for advice. Hey, what can I do? What should I be doing? So we walked through lots of different things and the mental aspect of it, and it really helped. About 12 hours later, I woke up in the middle of the night and I was just like throwing up, and it was going really downhill quickly, which was good. I was like, great, labor's starting. So then we drove to Mississippi. We got where we needed to be, and then labor just totally stalled. So I got checked. I was only 3 centimeters dilated. And at this point, I had already had broken waters for almost 24 hours. So we, made a plan. What should we do? I stayed for 3 days after that water was broken. And looking back, that's regret number one, because I was so focused on a home birth that I think I stopped focusing on a vaginal birth. So I stayed so long, I put myself in this bad situation. And by the time 4 days had come and gone, I was only 5 centimeters dilated. So really nothing was working. Mentally exhausted, physically couldn't even stand. My feet were just so swollen. So my husband looked at me and he just said, Nikki, it's time to transfer. And so I agreed. And then we had to come up with a new plan. Where should we transfer? We're 2 hours away from home. So we transferred even further away from Alabama. to Gulfport, Mississippi, which is about a 3-hour drive from where we live. Made the transfer, got there, they started asking me all these questions, and the first thing that set in was fear. How will I be viewed for staying at a home for 4 hours or for 4 days with broken waters? And so getting over that mental aspect of I'm gonna go to jail or something was really kind of what like crossed my mind. So anyway, they did all of these standard procedures and tests, and when they checked my blood work, I had an infection. And so that's really what changed the game, was an infection. So there is no epidural, there is no nothing. There is either no pain relief or you're going under. So they let me labor for about 6 more minutes. And then, the cascade of hospital interventions took over, and that's where things really took a turn for the worst. They said that I must have a C-section, and I just burst into tears and, said, I'm devastated. I remember I said, I am devastated, but they just explained to me it was best for me and my baby. And so we did that. But since I had the infection, I was put under general anesthetic. So let me tell you one thing I never prepared for with birth was having a C-section. So I prepared for the possibility of hospital transfer. I prepared for all of these things. Maybe if we go to the hospital, we'll need some intervention because that's why I'm here. But never one time did that cross my mind that I would be having a cesarean, especially under general anesthetic. And so again, at the time, I didn't even know what that entailed. And so really what it entailed was knocking me completely out. So missing the entire birth, not waking up for 3-4 hours after Hazel was born, having no idea when I woke up, like, am I alive? Is my child alive? I remember they asked me when they were taking me back, are you allergic to any medication? And I said, I have no idea. So the thought crossed my mind, what if they put me under and I never wake back up? So all these just awful things going through my head, but of course I survived. Hazel survived, which, is the bare minimum of what should be happening during birth. But so fast forward to the next day, I'm obviously totally out of it, under a lot of different medication. And then one of the nurses had come in, and I remember she removed my catheter. And I looked at Jonathan and I say, I think I'm peeing on myself. And so the nurse looked and her face turned bright white. And she said, no, honey, you're hemorrhaging. Mm-hmm. And so the next step that happened was we had 5 or 6 nurses just in the room, and they're yelling and screaming. Sorry. And they're saying, we have nothing in this hemorrhage kit. And I remember thinking, I'm not going to survive. So, they got everything together, and I had to sign a piece of paper for a hysterectomy. So I'm 33 years old, first kid, signing away. Number 1, my life. Number 2, the potential of having more kids. And so I go back for a second surgery, get put back under general. And fortunately, I did not have a hysterectomy. So that's my one silver lining of this whole birth story. But I remember too waking up after that happened, and this sounds horrible, but I heard a kid screaming, and I thought, I'm dead and I went to hell, and this is my hell. I was kids screaming, just so confused, like where I was, what was going on. So anyway, at this point, it's been 7 days of us being in labor, hospital, 2 surgeries, 2 generals, just a lot. And so to say that like the disconnect between me and Hazel was there is, of course, so feeling mad at myself, feeling mad at an innocent child for not just doing what she was supposed to do and coming out, all of that. But so we go home and just struggled for months. But I also went back to work after, I'm embarrassed to say, 3 weeks. So we go back to work, and then it's time to just, turn it back on, get back into, I've got a business to run, and I've got a family now to take care of, and I have a child who depends on me to be successful. And just really jump right back into it, which again, looking back, regrets. No time to recover physically, emotionally, just right back to it. So there's my birth in a nutshell.
It's a crazy nutshell. And I mean that wholeheartedly. And you took me back to the birth of my son when my wife hemorrhaged and I almost lost my wife. And it's a lot, Nikki. And I tell you that, we look at all this stuff and I, as a guy, it's a man talking to you. And I hope it doesn't come off that way, but I to tell you, I get it because I've been there and I've been on the other side of it. And the thought process of what was going through Jonathan's mind, I'm sure it was crazy. And I remember all that. You took me back pretty quick. So I'm glad you lost it because I almost lost it myself. So.
Well, I saw your face and then I was like, oh man.
Yeah. Well, this is it. People know I cry. So it's how it works. But you look at this and you said something that irritates me a little bit. You kept saying there's a failure or that it didn't, you have regret. And I don't think it's a regret as much as it's a silver lining and a lesson in the light that God's given you to understand, but more importantly, the most beautiful person you are and this amazing baby that came. But the understanding that you have now that most people, they can't even fathom. You've been given an amazing gift. 1, your baby, 2, your life, but 3, a light in the lesson that was pretty freaking dark and didn't go the way that we wanted it, right? And it didn't go the way that I wanted it from the birth of my son, and Julie wanted it. And I can tell it's the same for you. But I can also tell that you have an amazing 3-year-old daughter now that pretty much runs your office and is the face of your place. And it's something special to have children, chiropractic children inside chiropractic offices, especially when they're your own, right? And so what have you taken from that experience that was dark, didn't go as planned, didn't seem to be the best few months from start to finish here? What light has that brought into you to help you be an amazing, even the most amazing female chiropractor there is? What lesson did you take from that event?
Literally so much. And so one big thing was, I would say that before I went through the experience, my empathy for moms who did have a C-section was small. It was just thinking, oh, you didn't try your hardest, or you weren't educated, or you let them bully you into something that you shouldn't have done. Just my opinion on people who had C-sections, and thinking we could have prevented this. And I'm just living proof that you could literally do everything you're supposed to do and it could not work out. So number one, learning to be more empathetic for moms and for their choices, but also for their experiences. I have a very unique too, where I've also gone through labor and had a C-section. So I've seen both sides of it. I went into labor naturally with my water breaking and being in labor. So I also feel like that makes me unique too, because I've seen both sides. The only thing I did not do was actually push a baby out. So there is that aspect. But the second part of it is having moms who come in, and it happened in December, a mom doing everything that she was supposed to do. And again, not finding out at 39 weeks, baby was breech, and me being able to have this conversation with her, like, hey, this is what we're going to do. This is what our plan is. And then you can decide what you want to do. And so she chose to have an elective C-section, and I knew how to support her, because that's what she wanted to do. Mm-hmm. And she didn't want to try the version. She didn't want to accidentally go into labor. She chose that. And so I learned how I could support her with that. And she even mentioned, this sounds so vain, but I'm worried about a scar. And so I could say, like, hey, I was worried about that too, but it's really not that bad. So even just like the aesthetics of things, I can also relate to and, help moms with that. And then also just really learning while I'm in practice that everybody has their own unique story. And however I am here to support you is that if it's, you may not want to have an unmedicated birth, that's okay. You may want to have all of the interventions. That's okay. I'm still here for you to help you have the best experience in my office, because at the end of the day, whatever you choose, I'm going to help you get to that point.
Yeah. And I can't, hearing you say that, that gives me so much warmth, because I can just, I know how you think and how you feel, and just, I'd like, you warm me up inside immediately. I was like, wow, this is a woman that's been through a lot and learned a ton. And so have I in this entire experience. In fact, in this conversation, it's been completely enlightening. But more importantly, being a man, I've never actually experienced birth. I've never been through birth. I've been alongside it. I've held my wife's hand twice. Julie didn't end up in a C-section, and I should just change that phrase right there. End up is probably the worst thing we could ever say, because the thing that we need to understand as providers is we're here to give parents choices, and then support them in their choices. And that's the key. And you guys have, in this podcast, y'all have heard me say that you pride yourself on giving the parents a choice. And the last thing I ever want to hear out of my patients in our office and our practice members is say, Dr. Skip, I just didn't want to disappoint you. And it's not about me. And we hear that, and you're going to hear it. I know you've heard it in practice. I know the ones that are out there that deal in major family practices like we do, patients don't want to disappoint you. And it's not about us as a provider. It's about them. I don't want them to let themselves down. And it's such an important thing to understand and to hear out of your mouth, being that you've went through this and in the amazingness that's come out of this. Now, if it's okay with you, I want to ask you one more question.
Of course.
Yeah. Okay. So what have you done now in the last 3 years that has absolutely springboarded your success with your daughter now? Because I see all these awesome little pictures of that little princess running around, and God, y'all, you got to go look at Nikki's baby, Hazel Jane, because she's the cutest baby she's such a cute girl. Oh my God. I love looking pictures at her because she's adorable. She's freaking adorable. What have you done now? Because you did something that I kind of feel like I pushed you forward to, and I made you reward yourself with a goal that you were avoiding. I'm like, woman, we got to do this. You just hit a massive milestone in practice. You had one of the best months of collections you've ever had. What did you do to reprogram your neurology and work towards your rewards?
So I think a big thing too was knowing that I'm being a part of someone's story. So what just kind of popped in my head was that at first I felt literal jealousy, like, oh, this person just had a beautiful birth and I didn't get that, and I would be jealous. But now I'm like, man, I get to help people do that. So switching my mindset has really helped too. Gratitude, having a gratitude mindset is, I mean, it's amazing what just being thankful can do for your practice. But we've also really stepped up our game within the community. So giving back, hosting events, doing giveaways, supporting small business, just really doing videos about just like what we're talking about. How are these things that are affecting you be helped by what we can help you achieve in here? So just switching my mindset from just kind of going through adjusting patients, not caring about the outcome, to really caring truly about patient outcomes and having a massive gratitude mindset of what we as chiropractors can help people achieve. And even if it's something that we weren't able to do ourselves, that we can be a part of their story.
I think being a part of their story is key, right? Not being their story, but being a part of their story.
Yes.
And exactly. Yeah, those words, if y'all are listening, those words are pretty amazing from a pretty amazing chiropractic doctor, is to hear that and understand what she's been through, but all of the story and being a part of that story, and everybody else that's been a part of your story up until this point is pretty amazing. And Dr. Nikki, I absolutely adore talking to you. You're wonderful, and you're amazing on video, by the way. I've always like tuned into your videos when they pop up on my screen and stuff on Facebook, because I love them. I love your delivery. I love your voice. Like, I love everything about it. And so what are some ways that my viewers and listeners can get a hold of you? How can they contact you? How can they learn more about you, Dr. Nikki?
I'm on Instagram. My personal Instagram is Dr. Nikki Cottis. That's NIKKICOTTIS. My office Instagram is Cairo Connect Gulf Shores. And we're on Facebook too, Cairo Connect Gulf Shores.
So going away from this, what do you think is the most important thing that drives a chiropractor's success from your perspective, especially being a woman in chiropractic? What has driven you to your success?
What has driven me?
Mm-hmm.
Wanting to let Hazel have a better life than I did. And not that I had a bad life growing up, I had a great life, but wouldn't it have been nice for someone to help me pay for college, or just wanting my child to have the best but healthiest life that she can. So teaching her that there is a different way. So we need to live that mindset, live that model so that she can grow up and just have a better opportunity at things than we ever could have imagined. So she's truly what drives my success. Is as cliche as that sounds, it's like I do it all for my kids, but it's so true. You want your kids to see a good, healthy model of a working mom. My mom worked, and it means so much to me to think that I know that the sacrifices that she made were ultimately for us. And so I want Hazel to know that I work so that she can have opportunities.
Yeah, I think that's amazing. And y'all listening, if you can figure out the word that she said a couple times in there, was it's not why she does what she does, but what she wanted, what she wants for Hazel, what she wants for her family, what she wants. And then she figures out who in her life can get her there. And then she figures out the backside of it is actually the why, but the what is what drives everything. And I think as doctors, if we could just figure out what we want, then we can figure out where we want to go. So Dr. Nikki, I loved having you on. I can't wait to have you on again. Thank you for sharing such an intimate and deep story with us, and an understanding that I hope everybody listening to this, chiropractors out there, and even my patients that listen, to understand where this comes from, and to have providers that we are human and we're not perfect. And Nikki, I absolutely love you, and thank you so much for being on.
Thank you so much for having me and giving me the opportunity to share my story with someone who may be in a similar situation or find themselves in one day.
Oh, I love it. Well, y'all know how it goes from here. So get out there and get it done. Take care, everybody. Bye.